A 5-year-old boy, fever, lethargy, progressive bruising for 1 month, pallor, petechia, generalized lymphadenopathy, mild hepatosplenomegaly, anemia, leukocytosis with blasts, thrombocytopenia. Biopsy reveals sheets of small immature cells with scant cytoplasm and inconspicuous nucleoli. Cytometry shows TDT positive and expression of CD10 and CD19. Which of the following additional findings is most likely present in this patient? So it's another and last ALL case, acute lymphoblastic leukemia. And we'll see what we're used to see in such cases: the bruising, pallor, petechia, lymphadenopathy. Also, the CBC shows 2 cytopenias, as we already spoke. We see anemia and thrombocytopenia. And by the way, leukocytes could be high or low. We didn't talk about it before. What you need to know is that high leukocyte count, more than 50,000, carries a poor prognosis. And we didn't stress on that in the previous video, because being that high means that lymphoblasts have spread from the bone marrow to the periphery. Also, this TDT positivity in the cytometry is classic, as TDT is positive in 95% cases, and this is also very high yield. So now let's look at the choices. Choice A, incorrect, because lymphoblasts lack peroxidase activity, and this is versus myeloblasts in AML, acute myelogenous leukemia. Choice B, incorrect. This translocation is typical for APML, acute promyelolytic leukemia, which is the most important subtype of acute myelogenous leukemia. Also, choice C is incorrect. Our road is also classic in acute myelogenous leukemia too. Choice D is the correct answer. It's a bullet point you should know that lymphoblasts lack peroxidase positive granules, but positive cytoplasmic aggregates who pass positive material. And of course, choice E is incorrect. Actually, ALL can have this translocation. We mentioned it before, the Philadelphia chromosome, and we said this is the one with the poor prognosis. But this is not the typical one. It's typically T1221, which is the one with the good prognosis, and this is the most common one. So this is incorrect too. And here are our side notes, which I recommend you to read.